always in pain.
I feel tired.
I'm not able to concentrate.
I have digestive problems.
I go to the toilet very often.
My mood is very variable.
I am taking more and more medication.
I feel lost.
I have tried everything.
What if all these symptoms had points in common?
What if we could help these patients by improving their quality of life?
In an effective and safe way?
Not only that, in a simple and long test lasting way.
Welcome to this fantastic webinar about Nesa neuromodulation for Netherlands. It's a pleasure to be here. I am Raquel Medina, a physiotherapist and a doctor in neuroscience, and I would like also to present my colleague María González. She's also a fantastic physiotherapy specialized in pelvic floor and also a well-experienced NESA professional. This webinar is very interesting for you and for your patient, and I will ask you to recommend that at the end of the webinar you can ask and share your impression in the chat that you can find next to the screen. First of all, if we want to understand in a better way Nesa neuromodulation, we have to refresh a little bit about the bioelectricity. Why? Because it's an electrotherapy. Indeed, it's a non-invasive electrotherapy that you can use with your patient or even with you. And as all we know, the bioelectricity of the body normally runs by nerve. This is a common knowledge that all of us has. However, the bioelectricity in the recent years have demonstrated that it's not only in nerve. There is also in tissues and cells. Imagine, some researchers have demonstrated that when a cell wants to do a mitosis, they have to divide the polarity in order to achieve this physiological process. So to understand Nesa neuromodulation, we have to understand it's an electrotherapy that uses bioelectricity. But where? For what? For the autonomic nervous system. Due to the parameters is a perfect neuromodulation, perfect technique to modulate and to create changes in the autonomic nervous system. And if you remember, the autonomic nervous system is divided into parts, sympathetic and parasympathetic. The sympathetic is an active moment, is an active autonomous nervous system that is perfect for fight and to active our body. And the parasympathetic normally is for calm, for chill. It's the chill out part. But this concept, we always learned that in our degrees. But the reality is, if we talk about sympathetic and parasympathetic, we are talking about peripheral. But don't forget, the autonomic nervous system is controlled by the central system. Actually, the spinal cord, the hypothalamus, at the key of the autonomic nervous system is the limbic system. And if we talk about the limbic system, what we are talking about? Yes, you have read my mind. Emotions. So the autonomic nervous system is controlled by the emotion. This is a very interesting concept because it's the perfect relationship between the biopsychological concept of the patient and the treatment. In addition, we can't talk about autonomic nervous system without talk about sleep. Why? Because the Nesa neuromodulation have demonstrated that it's a perfect tool to modulate the autonomic part and also to improve the sleep quality. Do you usually ask your patient about the sleep quality? It's very important because a patient with chronic pain, a patient with an inflammatory disease, or a knee problem, or whatever, a back problem, probably this patient don't sleep well. It's very important to have a well-balanced autonomic nervous system in order to have a well-balanced sleep, because if not, our pain can increase. Our balance can be affected. Indeed, in fact, If you don't sleep well during years, it's very, very probably that you will have cardiovascular disease. Or, for example, there are some research that have demonstrated a relationship between bad sleep quality and Parkinson or Alzheimer or immunity process. So at this point, the autonomic nervous system is very important to control, to recover our homeostasis, to recover our body, but also to control the disease. And imagine all that kind of patient that you usually have with a lot of disease that probably have an autonomic nervous system unbalanced. And if we could influence the autonomic nervous system?
All we know, Raquel, that the autonomous nervous system is a response system. So what are the correct stimuli to have the better responses? Following the scientific evidence, we know that we can stimulate the autonomic nervous system with the nutrition, doing exercise, meditating, breathing, with our posture, or smiling. But we are here because we know that we also are able to modulate this autonomic nervous system in an electrical way with electrical stimuli based on low parameters that are going to produce the effect, the response of the autonomic nervous systems in terms of adaptation to be adapted to the external and internal stimuli, and then to treat the symptoms that are related to. So here we have a NESA microcurrents that works with 24 electrodes that are placed in hands and feet in 24 points of low impedance through these inlets and glabs. And the microcurrents coming through these electrodes, trying to find one electrode that is going to be the maze closing the circuit. So we are going to neuromodulate this autonomic nervous system in a global way. And this is the reason because we are going to have all the improvement in all the symptoms that are in relation with this autonomic nervous system. It began in 1970 with a group of engineers and doctors who were spending years trying to find these low parameters that produces changes in terms of neuromodulation, of adaptation. After 20 years, they got it, but because of some situations, they need to stop the project, and was in Spain, in San Sebastián, in 2014, where the son of one of these investigators restarted the project with focusing in the clinical evidence, but doing or giving lots of importance to the scientific evidence. Because in the clinic, as me, we know that our patients improve when we treat with NESA neuromodulation, only with NESA or combined with other techniques. But we are encouraged, and you are working really, really hard, really, Raquel, in your laboratory of Las Palmas de Gran Canaria to try to translate all this information, the clinical results, in scientific evidence. We are now not alone. We are with lots of people. You can see here we have lots of different certificates. Now, Raquel and me, we are in Canada. Yes, Raquel.
Yes, that's right.
We are not only now in Spain or Europe. We are all around the world in more than 1,000 clinics, in hospitals, with collaborators doing research, hospital, universities. And it's important for us because we want to share with you that we are now a really high community working in the same line, giving the most importance, and with our main goal is to improve the quality of life of the patients in terms of neuromodulation.
You're right, Maria. The science matter, and we started in 2019 in Canary Island. That's right. But fortunately, nowadays we are more than 15 universities working together, with the only goal that have evidence about NESA neuromodulation. During the last 6 years, we have developed a lot of clinical trials with high quality based on different kind of patients with different disease, but with only one thing in common: autonomic symptoms. I mean that, for example, people with fibromyalgia, with multiple sclerosis, or maybe an elite sporter that wants to improve the performance has the same thing in common: control and regulate the autonomic nervous system. Also, we have clinical trials with placebo groups that hide very well the quality of these studies. Due to, we have demonstrated in different fields, in different symptoms, an improvement in different kind of things. For example, the life quality, very important. If we can improve a little bit, just a 5%, the life quality of our patient is fantastic. We can talk about also sleep quality, pain control, or for example, constipation, bladder problems, chronic pelvic pain, for example, stress, anxiety, headache, things that are the same thing in common: an unbalanced autonomic nervous system with different symptoms that produce the problems of these patients. But how it works? Physiologically, how Nesa neuromodulation or Nesa microcurrent works, Maria?
Raquel, Nesa has its own characteristics that make it different. So here you have that Nesa works with the 24 points that I explained before, but with the microcurrent that is based in biphasical and symmetric current with the polarity positive and negative. But what makes it different, and here you have an example that is going to be really clearly for you, in the sequence 3, the electrodes that are placed in hands and feet are going to be connected for the same side. So left hand is going to be connected with left foot and right hand with right foot. It is going to be changed, as you can see here with the lights, every 130 seconds. So we are not going to suffer the accommodation or to receive the accommodation. As you can see here, the parameters are really low. We are working less than 1 milliampere in low frequencies, and in voltage that we can change from 3 volts until 6 volts. And we are going to choose the 9 programs we are able to, that the microcurrents device provide us to do our own receive for each patient. And this is the important because we have lots of different kinds of electrotherapy, but all the electrotherapy is going to have their own effects depending on the parameters they work with and the characteristics they have. Andrea, if you could change. Thank you. So when I have the patient and the patient arrives to the clinic and I consider that Nesa microcurrent is going to help me, what do I have to consider to have my better results with this patient? Well, I have 2 variables. The first one is the location of the electrode, the directional electrode that I explained before is the electrode where the electrical impulses are going to be concentrated. So depending on where I place this location, this electrode, we are going to have some effects, always neuromodulating in a global way. We have 3 locations. We have the central, metameric or segmental, and focal. Central we will use when we want to produce the general effect, a systemic effect, for example, global pain, sleep, fatigue, chronic fatigue, general fatigue, and at the beginning of the treatments when patients are the first contact with Nesa. If we want to emphasize in an area, we're going to use segmental one. For example, if we want to treat the pelvic floor, we are going to use the lower thoracic vertebrae or the upper lumbar for the sympathetic, or maybe we are going to the sacrum to emphasize in the parasympathetic or somatic nerves, and it would be a metameric. Or if I want to treat my knee in the ventral part, in the anterior part, I will consider that information is in relation with the femoral nerve, and I will go to the from the second until the fourth lumbar vertebrae, or in the middle, or maybe if I want to have an unilateral effect, I will go in one side. And the focal is when I want to centralize the electrical impulse in a small area. For example, not only in pain, but for example, if I have pain in my knee, I will put the directional electrode in my knee. But also we know that if we want to emphasize in the vagus nerve, we will place it in the sternum, or maybe for improve the quality of sleep here in nasium, or maybe if I want to improve the digestive symptoms in the mesenteric plexus. So these are the three locations we can choose: central, metameric, and focal. After that, we are going to choose between 9 programs. We can choose one of them or maybe combine them to have the better results with our patients. We have only 9 programs. It's really easy to use NESA. Now maybe you are thinking or you're worried about, oh, it's really complicated for us. No, it isn't. It's really simple to use it, and we train it to you to have the better results. And now, when I think for me that I am clinical, this is the most funny part of the treatment of NESA is to choose the better programs with this patient. So program 9 would be for the hormesis, is the minimum doses we give to the body to have the benefits without side effects. So we are going to use it at the beginning of the sessions when patients are the first time in contact with the microcurrent, or maybe if our patient has lots of comorbidities, or maybe if they are really weak, or maybe if their heart rate variability is very low. Program 2, 3, and 4 are the same programs. The difference is between which electrodes is coming into the body, the microcurrent. Program 2 is going for the ventral part. Program 3 for the dorsal, posterior part of the body, and program 4 for the sagittal part. For example, if I want to have the main effect in the part in the face, I will choose number 2. If I want to have the main effect in vagus nerve, number 2. In my knee, number 2. Digestive problem, number 2. But if I have back pain, I will choose number 3 because it's for the dorsal part. In this case, it's important for me. I love the pelvic floor. Number 3, the microcurrent is entering into the body through the posterior tibial nerve. And we have lots of scientific evidence of the good effect that we have when we neuromodulate through this nerve. So if we have pelvic symptoms like overactive bladder, we will choose number 3. And number 4 for the sagittal part, for muscles that stabilize our body, or for proprioception, or maybe to improve the quality of walking. So look at this. We are answering the question with program 2, 3, and 4. Where do I want to have my main effect? Now, if we want to answer the question, what do I want to produce? Which effect do I want to achieve? I will use next programs. Number 5 would be for the fatigue, not only chronic fatigue, also acute fatigue, and to optimize our resources of our body. It's really useful because it's a little bit different. It works with a monophasic and cathodic, and it's in relation with the synthesis of ATP in the mitochondria. We normally go deeper in the campus on all the knowledge we share with you if you come into the Nesa World moon. It's really useful for us for this kind of patients. Number 6 is the program for the pain, the analgesic program. And we normally have the best results in neuropathic and nociplastic pain. But if we have long-term problems with the pain, we are going to combine number 6 with number 7. Number 7 is our best program because it neuromodulates the autonomic nervous system by its own. So we are going to use it, I think, in maybe not all, but maybe yes. I normally use it in all my patients, maybe in a few minutes or in a longer minutes. Why? Because if you have problems with the vagus nerve, we are going to use number 7. If you have bad quality of sleep, we are going to use number 9. We have research in children with neurodevelopmental disorders where we used number 7 to improve the constipation, and it would also be number 7. Or for example, in overactive bladder, we will use number 7. So normally it's present in most of our protocols or our sessions. Number 8 is going to have the main effect in the central nervous system. This is the reason because we talk in terms of stress, anxiety, focus, and concentration. As Raquel explained before, in the hierarchy, we are going to come through with the microcurrents through these peripheral pathways, but the response comes from this central nervous system. So we consider a lot number 8, including in problems that we have in a chronic way in peripheral parts of our body, because all these symptoms are centralized. And finally, program 9 for the area, the cranial and orofacial area. And now here we highlight the facial and the trigeminal nerves, but also, of course, we use number 9 for migraines, for symptomatology in this area in relation with all the cranial nerves. As a summary, patient arrives to the clinic, and I want to do the good clinical reasoning with a good and wide clinical history, and I decide to help them or to help him or her with NESA. And I'm going to have some targets that I'm going to fix with the patient. For example, I want to treat your pain, your quality of sleep, and your anxiety. And with these targets, we are going to choose some, Raquel will explain in a few minutes, some evaluations, maybe questionnaires, scales, or other tools. And I'm going to do my own receipt for this patient, choosing the directional electrode and combining the 9 programs. And we will do it for a few sessions. We normally say that at least 10 sessions. And at the beginning, we need to use it really often, at least twice per week, if it's necessary, 3 or 4 times per week, because if we talk in terms of neuromodulation, and if we talk in terms of this microcurrent that is coming through your body, not only stimulating the nervous system, also as Raquel explained with the bioelectricity in the conversation that the cells have between each other, coming through this fascia because of the piezoelectricity, we need to repeat the stimuli really often at the beginning. And when the patient starts improving, we are going to distance the sessions. So here are our applications. Our applications are in relation of all the symptoms that are related with this autonomic nervous system. We have the anxiety and stress, of course, injury recovery, because the recovery and the regeneration depends on this autonomic nervous system, the parasympathetic and the sympathetic nervous system, the sports performance, to have the best results, concentration in your sports functions, and also to recover, to treat the fatigue. Overactive bladder, and I will like to add here, not only overactive bladder in the pelvic part of our body, we can talk about sexual dysfunction, chronic pain, constipation, and other symptoms that are in this area. The chronic pain I explained before, also the acute pain, the nociceptive one, concentration and attention. And look at this, I am going at finishing these applications to talk about sleep quality, because it's one of our main priority. We need to consider the sleep quality in our patients, because it's going to give us lots of information about the capacity and the catabolism and anabolism processes of our patients that are really necessary to have a good quality and healthy life. So ending with this, we have contraindications, yes, of course, but look at, because it's a microcurrent, so it means that we are only to have a main contraindication, that is the pacemakers or electrical devices that are implanted in the body and you can switch off during the treatment, and pregnancy. The rest are the same as all the microcurrents, the acute processes, bleeding, maybe thrombophlebitis is in acute process, or if you have phobia to the electrotherapy, of course. But it's not only with NESA, it's with all the electrotherapies we have in our market, As a relative contraindications, we are going to have cancer. That is one of the questions everybody asks us, really, Raquel, because we are able to use microcurrents. The scientific evidence is near this concept, and we are able to do it in a safety way. But we have to consider the process that the patient is suffering, where it is, and of course, if the doctor that is leading the treatment considers is useful and is safe for this patient. And we have the other one. I'm not going to go deeper because we don't have enough time, but we explain it really, really, really deeply when we introduce yourselves in NESA mood and the precautions that are in relation of the application of the device, the technology of NESA microcurrents.
Yes, because the treatment is very important. Of course, the anamnesis and the interview, but it's most important the evaluation. It's very important to recover all the data of the patient and of course objective data. You can use, if you want to know more about the autonomic nervous system situation of your patient, you can use all kind of tests and scales related with the symptoms. For example, a scale for sleep quality, test for pain, etc. But in case of the autonomic nervous system, exists a gold standard, is the heart rate variability. You can check the autonomic situation of your patient thanks to an electrocardiogram. If you are a physician and you have an electrocardiogram very near of you, it's fantastic. But in the case that people that have a clinic like a physiotherapy without electrocardiograms, you can use WeCardio. WeCardio is a very useful tool, very small, connected with an application, the mobile phone, that, by the way, is included with the NESA neuromodulation, and you can check there the changes of the autonomic nervous system of your patient. And of course, for example, for sleep with actigraphy or a ring, the ring that you can use to check the sleep phases in our patient. Of course, hormone tests, blood tests, whatever you want, whatever you need, you have to check it. Because the autonomic nervous system produces symptoms, and these symptoms can be measured. But don't worry, you are not going to be alone. If you start with NESA neuromodulation and you enter in the Nesa World, you will have a lot of training, a lot of courses, a huge virtual campus where you can check information, clinical guides, and of course always a support behind you with professionals that can help you to start in this field. Just to sum up before finished, remember, you have to bear in mind that bioelectricity is a very important part and a very important goal to check and to treat our patient. And nowadays, NESA neuromodulation is a perfect option to modulate the autonomic nervous system in order to produce and improve in our patient a better life quality or control specific or chronic symptoms that normally are very difficult to treat in our normal day. And of course, you will start with a huge team behind you supporting you. Now is your moment. We like you to answer the question, do the question on the chat and ask us about your doubts or your impression. Wow, I think we have so many questions, Maria.
Yes, I'm going to start with the one that is anonymous because it's general, this question. It's not the name, but it's asking about how many sessions are needed for fatigue. Oh, this is a good question in general because the session depends on the start point of the patient, on the capacity of the response of the autonomic nervous system of this patient. So if we have two different patients and we do the same treatment for fatigue, we are going to need different number of sessions because depends on the capacity of the response, the autonomic nervous system. But I can tell you some tips. In my clinic, with my experience, normally fatigue, when we use number 5 and number 7 for these patients, they're going to improve really early. I normally treat patients with McArdle, that is a disease that affects to this glucogenesis, to the fatigue, and they improve really early the feeling of fatigue, and they feel with more energy. We normally treat them at least twice per week. So in the first 2 or 3 weeks, they are improving this feeling of fatigue. These kind of patients, when they arrive this day, they are not able to do anything because they are really tired. And when we treat them, they feel that they can finish the day with lots of energy, they are motivated to continue doing lots of different activities. Sometimes they need a maintenance. It means if we distance the sessions and after 10 or 20 sessions they are really nice, maybe they need reminding session each 3 or 4 weeks. But they consider it a lot because to not feeling tired and to feel energy is really important in this kind of patients. But also, for example, in sports people, it's not necessary to have a disease. Also patients that are in a high level sports performance, they use it to not feel fatigue and to have better recovery to continue the competition and the existing schedule they have in competition.
Well, we have here another question. It's very interesting, Maria. You will like it. Is from Kate, or sorry, because if I cannot pronounce the correct of the name. There is a treatment protocol for patient diagnosed with Parkinson's disease. Here, I would like you, with your permission, Kate, to say you that this is not the correct question. The correct question, it would be, can I use, or there is treatment protocol for the symptoms with a patient with Parkinson? I mean, the NESA neuromodulation treatment or technology is not specific for a disease, because sometimes we are always thinking about disease. Okay, fibromyalgia or a new problem, knee tendinosis. We cannot think about disease. We have to think about the symptoms. So that's why Maria says that it's very important, the interview, because it doesn't matter the disease. It doesn't matter the name of the patient disease. The most important part is the symptom. What kind of symptoms does your patient have? For example, it's a Parkinson's disease, okay, but maybe this patient has pain, has a sleep problem, has constipation. Depending on the symptoms, you can have the answer is NESA neuromodulation is the perfect tool. Of course, if this person, it doesn't matter the disease, has sleep problems, that's right, NESA is your tool. Do you agree, Maria?
Yes, of course. It's important to understand this concept because our main objective is treating the balance of the autonomic nervous system, and it's going to be translated in some symptoms. All these symptoms are going to have a good response with NESA microcurrents, but not the disease, as Raquel explained. This is the difference.
It's very important. If you understand this concept, you understand the whole NESA physiology.
Yes. Here we have one that I want to share. Ad says, we are treating the neurohormonal system, blood sugar level improve in a patient during NESA treatment. Yes, we know it. It's really often that we have these registers. Do you know about hyperthyroid function? Would you consider treatment? Yes, I consider it. With diabetes, we have, clinically, we would like to translate it to scientific evidence. Raquel, you have a lot of work in this line. We have good results registering when they treat with NESA. If we have patients with problems with the thyroid, of course, because the axis of the hormones are in relation with this autonomic nervous system, and we know that we can improve the levels of cortisol. because we have research on this. So it makes sense for us to treat this patient. Remember, trying to improve the symptoms that this produce to the patient, okay? Not trying to improve the disease that causes the symptoms. This is the only difference.
That's right. Remember, hormones are controlled by the autonomic nervous system. It's the homeostasis. Remember the hierarchy that we have been talking about. The hypothalamus and the limbic lobe control the autonomic part. So hormones is a good target to check as an evaluation with our patient. Actually, in Canary Island, we are developing right now a doctoral thesis in a female elite sport team, a footballer team, and we have checking, for example, estrogenous, we have checking cortisol, we have checking hair rate variability, some hormone related with the menstruation also. So it's a good target. Probably in the next year we will have more research about this, but diabetes is a good option if the symptoms of the patient is according to the NESA treatment, of course. Well, we have here another interesting question that is, can NESA be used in children? Of course, you can use NESA because it's a microcurrent, remember that Maria says. It's a microcurrent and you can use in children. Our recommendation is children over 2 years, not for nothing special. It's for the size of the electrode. Remember, the electrode is located in globes and anklets, so you need to have at least 2 years because of the size of the children. And if you want to know more, there are research about with children, for example, in cerebral palsy. And nowadays we are developing also research or clinical trials in autism. Yes, autism. Why? Not for the disease again. We are not going to treat the autism, but the children with this disorder normally has a very poor sleep quality, and of course they usually is very hard for them to control the concentration and focus, and we are working on that in these symptoms, and the results, it's developing really, really good, not just for the children, also for the parents.
How important it is treating both. Yeah. And here we have the Cs. I don't know if this is the correct pronunciation. Cs. The question is, do you see that nutrition needed for neurofunction, like minerals or myelin or tryptophan, can be helpful for effective treatment? Of course. Normally we say that we need to talk to our body in the language that our body understands. And one is the chemical one, maybe with pharmacology, with the nutrition, with oligoelements, with complements. Also the mechanical, maybe it's with exercise, movements, or massage, and in electrical way. In this case, we have to consider that the microbiota is relation with the vagus nerve, and it's in terms of our homeostasis. So it makes sense for us. This is the reason because we have some nutritionists that are working with NESA, having really good results with patients that have problems, digestive problems, or maybe problems in the absorption of the nutrients or some elements they needed to be balanced in a healthy mood, healing, we could say.
In fact, nowadays there are a lot of professionals working with NESA,
Yes.
neuromodulation, not just physiotherapy, also physicians, dentistry right now to control the anxiety and the pain, for example, during the intervention. And the recent year, some nutrition, some professional in this field in nutrition is using NESA neuromodulation also in order to combine. Remember, NESA is a new tool that can help our treatment. It's not just the definitive treatment for all. It's a tool that I can combine to boost the autonomic regulation. So it's important to have another kind of treatment or combine other things with NESA neuromodulation, of course. We have to do exercise, we have to have a good nutrition in order to achieve our goal. improve the autonomic nervous system. I always recommend that NESA is a new tool. It's very useful, but don't forget to educate your patient. The patient have to do exercise, have to do very healthy habits. It is fundamental for that. Okay, it's a complement. Remember.
Yeah, this idea is really important because most of our patients are not going to be treated only with NESA. NESA is going to upgrade our treatments. In my case, I work every day with 5 devices, and I am doing the same I have done until I get the first NESA. So, but NESA improved my results. Let me to have the better results early, and of course give me the opportunity to treat some symptoms that I couldn't before, like the sleep quality maybe, But in most of the patients, we need to combine the different tools we have in our hands to have the better results with our patients.
Sure. Well, we continue. We have here another question, Erica. Maybe this is a fundamental question you probably wonder. Erica asks, can you buy a NESA neuromodulation system? Of course. Nowadays, NESA neuromodulation, it's selling in Netherlands. From 1 year ago, they started to sell there with Physio as the official distributor in Netherlands. You can buy it, of course. And of course, wherever you are, whatever part of the world, you will have all the support and you will have all that kind of information that we have been talking about. And at this moment, I would like to relate another question that Sis says, that is, do you have experience center in Netherlands? That's right. After a year, there are a lot of centers in Netherlands that are starting to use NESA neuromodulation. And if you contact with Physio, at the end of this webinar, you will have the contact. You can contact with them and they can offer you all the information about the NESA neuromodulation in Netherlands and the opportunity that you will have with them.
Yes, we are growing so much. So, Mita, can the symptoms of PCOS be treated with NESA? Okay, in the polycystic, there is a problem of the cysts of the ovaries. So in this syndrome, remember that you need to change the question a little bit, because when we treat the symptoms, maybe we need to consider that, you have done it really nice. You got the idea. The symptoms of this syndrome are really wide, are in relation with the inflammation, with the hormonal dysregulation. Both are in relation with the autonomic nervous system and the response. Are in relation with the pain, we can treat it with NESA. So now, at least we have 3 causes why we need, or why I will use NESA with this patient. But you need to consider why, for what, and what you are expecting, because if we have problems, maybe the response comes from the endogenous response we are able to do, and it's going to be translated in symptoms. Under my experience, people who have this kind of syndromes, I'll help them in the inflammation phase, in some parts of the cycle where they have more inflammation, because the inflammation depends on the autonomic nervous system, and we need to have in this moment the sympathetic and the parasympathetic balance to have priority one of them when we need it, in the pain also, and in the regulation of the hormones, but not always is going to be translated in the regulation of the cycles, because the cysts are going to be there, and the response of the body is going to be also to this, that is affecting inside the patient. So we treat it with focusing in these objectives. One of the things and the tips I would like to share here, most of these patients have lots of pain when they sleep, when they relax in the night. They need to have some pharmacology because they are not able to go deeper in the parasympathetic part of the body because they are in alert, because they are not good. So we improve the anxiety and the quality of sleep in this patient that has these problems every month normally, these symptoms. They control the symptoms better with the body neuromodulated.
That's right. We have here another question. It's Saskia. If NESA is working on symptoms, very well, how can it help with trauma conflict in life? This is very interesting because we have a lot of colleagues, psychologists working with NESA. They are working normally in combined treatment in an active mode during the session, the psychological session, in terms of these symptoms, in terms of the situation, conflict, stress, problems with relationships, trauma with death, or for example, also in anxiety or depression. Could be a good option due to, remember, the limbic system, because emotions are a very important part of our life and can produce symptoms. Emotional problems can produce an imbalanced autonomic nervous system. Do you agree, Maria?
Yes, of course. This is one of the questions we always need to ask to our patient in the clinical history. It's about if they have suffered or they are suffering any trauma or any emotional process, because the limbic system is going to lead everything, and the hypothalamus is going to have the manifestation in the body. We normally say that our body knows what our brain doesn't realize, you know. This is because most of the manifestation we have about that are the consequence of emotional processes, maybe it's a trauma or maybe it isn't, are going to be how do you say translated, or are going to be explained, or are going to be manifested, are going to be manifested in our body. So it's important. And if it isn't, we know that we are going to have some parts in overactivity as the amygdala, the hypothalamus, and it's not going to allow us to have executive functions with the cortex well done, because we need to have this balance, and it depends also in the autonomic nervous system. This is the reason because lots of psychologists are using in the therapies at the same time NESA with the treatment they do, because we need to balance it. We don't put our autonomic nervous system in the best conditions to be able to have the better response to external and internal stimuli, we are not going to achieve the best results.
Actually, in terms of research, there are one university collaborator, a doctoral thesis, that is working in a new project. For example, with NESA neuromodulation in children, in teenagers, due to analyze cognitive process and educational results. So imagine, it's very interesting. Of course, it's very logical. If, for example, a teenager is in a good mood with a control and a balanced autonomic nervous system, it's better for example, the studies, or it's better for the relationship. So emotions are the central part of our life, and of course influence in all the disease, in all the physiological situation. Well, it has been very interesting. We don't have much time. It's a very pleasure to be here, apart virtually in Netherlands, physically in Canada, but
Yeah.
it's fantastic to share with you. Thank you very much for your questions. And remember, if you want to know more, you can contact by the webpage, also the emails, and of course with our fantastic distributor, Physio in Netherlands. And I would like you recommend an upcoming event there in Netherlands, the 11th of February.
I feel that I am a different person.
I can now do more activities in the day without feeling fatigue.
Pain is no longer present in my life.
Now my rest is restorative.
I feel motivated.
I don't visit all the toilets when I am away from home.
I am going to restart my studies because now I feel I am able to be concentrated.
These are statements that we hear normally in clinic after NESA microcurrent treatment.
Sounds simple, doesn't it?
Yes, it is. It's up to you. Don't stand still. Move with us.
As Albert Einstein would say, insanity is doing the same thing over and over again and expecting different results. Thank you.
Thank you very much.